Hello, Mates Thrive Nation. Today's all about brain health, mind health. It's with a board-certified functional neurologist and chiropractor laser expert with Dr. Brandon Crawford. Welcome to the show.
Thank you so much. I'm a big fan of your work. I'm very excited to be involved today, and thank you for the invite.
Pleasure. And I see that you have got NeuroSolution in Austin, in Atlanta, soon to Dubai. And hopefully we can have a chat soon about South Africa, because I just love the work you're doing with light and lasers. I've been in practice 25 years, 17 years as a functional medicine, practitioner and expert, and done over 29,000 sessions of prolotherapy, including thousands and thousands of sessions of platelet-rich plasma, especially in the cervical spine, treating the vagus nerve. So hopefully we're going to have a really good in-depth conversation about treating the brain in the most novel and unique ways. But just to set a bit of a frame, because I know how important neurology is, what is a functional neurologist?
That's a very good question. And I guess the first thing to note is, sounds like you've been around for a while, right? So you're clearly taking care of yourself. You're looking good. I got to take some lessons from you, right? I'm starting to get too many white hairs here, but congrats to you in your work. You're doing fantastic. But yeah, that's a really good question. I get asked that very often. So basically, there is a difference in functional neurology versus your typical, standard neurology practices, where we're the guys that come in whenever we look at the MRI and there's no like ablative lesions, right? There's no tumor, there's no, something like pressing that you can do a surgery for or something like that. We're the guys that come in and do the functional evaluation. And we go, okay, based on these metrics, we know that there's imbalances in the nervous system here, there's dominance here, there's underdevelopment here, et cetera. And then we employ strategies using physical receptors or chemical receptors, whatever it may be, to then establish neuroplasticity within the nervous system so to then create functional gains for that person.
Brilliant. And maybe you just want to define neuroplasticity and neurogenesis, because I think there's a understanding or traditional Western dogma around plasticity and neurogenesis, because I do understand that you see children, adolescents, teenagers, but you just see about a professional sports person now. So you're seeing adults as well.
Yes, absolutely. Neuroplasticity, it's basically a double-edged sword is what I tell people. You can have negative plasticity, but you can also have positive plasticity. And then what the misunderstanding is that so many people think that outside of childhood that neuroplasticity essentially stops, and that's just not true. There was actually one study that was done in hospice care where they took this very ill older population. If there's not going to be neuroplasticity, it's going to be in this group, right? And so what they did is they studied their brains. So they're actively dying. I think the average age was like 90 years old. And what they found was that even in this population, there was still neuroplastic change occurring, right? So neuroplasticity is essentially the ability for the brain to mold and change. And that's very, very important because no matter what our scenario is, what I tell people is, look, if you just had this debilitating brain injury, your brain is not going to stop. Your brain is going to constantly be changing and trying to redevelop, trying to heal. It does not stop until it's dead. So neuroplasticity is the cornerstone of everything that we do. Our intensive care is geared towards that. Our laser enhanced PRP program, all of the things that we do is geared towards establishing positive neuroplastic change within the brain.
Brilliant. I want to talk about 3 avatars. Maybe you want to talk about 2, and just give me an overall story that people can grab hold of. I then want to talk about your assessment, your auditing, what you do, and then using light and all your therapies. But people are listening out there and say, okay, so my brain's neuroplastic, there's neurogenesis, I can create new neural pathways and new highways in my brain and new connections, which is really, really important. But possibly an avatar that I'm seeing more and more in just out there, client, female or male executive comes to me, and we've got a big corporate wellness business as well, saying, listen, they feel burnt out, they got brain fog, tired, inability to complete tasks, sleep dysregulation now, not sleeping as well, maybe diagnosed with anxiety, maybe on an SSRI or even a natural supplement, just not feeling good, feeling the pressures of life, exhausted a lot. I mean, one of my biggest complaints now is fatigue, with this mental, emotional fatigue. So that's the one avatar that possibly you can tell us, a story, an overview story. And the other would be children that I'm seeing diagnosed with ADD or ADDH or being on the autism spectrum. And that would be the other avatar that I'm just seeing more and more and more of. So take us through an overall story of someone who came in, they were like this, and they radically were transformed.
Absolutely. Okay, so let's start like this. Let's start by saying we understand that the brain has this developmental blueprint, right? So we all know this. We know that a baby has to crawl before it walks, right? We know that from a structural standpoint, but also from a neurological standpoint. So it doesn't make any sense to take a baby that's 3 months old, stand it up and say, okay, let's walk, right? We don't start gait training at 3 months old, right? So we know that there's this blueprint and it does not stop whenever that baby is up and walking and et cetera. That continues out through young adulthood, and then I would argue even through our older ages, right? So the first thing we need to acknowledge is that the brain has these mechanisms built in. Now, if we're going through life, and let's say that there was an issue that caused some temporal coherence issues, so some type of lack of processing along the way, be it an injury, be it a chemical or a toxin or emotional trauma, whatever it may be. But there's this blip, this chink in the chain, right? Now we start developing compensations, and we start developing imbalances, et cetera, right? So what that can look like over a period of time is maybe it's a chronic stress, right? Maybe that's a chronic inflammatory event. Maybe that's something that leads to chronic fatigue, leads to something like depression or whatever it is, right? And so the answer then may not be going to a medication or needing something like that. The answer might be, hey, let's back up and let's examine this process. Let's check this person out. Let's look at their sensory systems, their primitive reflexes, postural reflexes, core stability, vestibular balance, eye movements, and cognition, right? And those are the big buckets, the big different categories that we check throughout our exam process, right? And so that's step one. Let's figure out where the issue may be, the functional issue, right? And then if there's something in those buckets, if you will, in those categories, that describes the therapy they need, that tells us what they need. So the exam is very, very important, that functional neurology exam, right? So if someone with anxiety comes in, right, we see that anxiety is very much tied to the Moreau reflex. Also, perhaps the fear paralysis reflex. So if we go back and we want to talk about the Moreau, so the Moreau is that reflex where if we're laying a baby down and then their arms go back and they start to scream, right? That's the Moreau. But the Moreau actually starts to develop in utero. And whenever the mom starts to feel kicks in the womb, that's the baby going into flexion and extension reflexively due to firing this Moreau reflex. Why? To begin to develop core tone. Why? So it can get out of the womb. So all of these reflexes are connected to a purpose, whether it's safety or movement or whatever it may be, right? And so if we can acknowledge that, and if this person has, for example, this Moreau reflex and it's presenting as anxiety, then that presents a very substantial and sustainable treatment approach that can greatly improve someone's life. So a good example would be, we were working with, it was a teenager, actually, someone on the autism spectrum disorder. So this will kind of get two birds with one stone. But I'll start with the first one that you brought up first. So the mom actually had debilitating anxiety. The mom was a high-level executive. She was, overworked. She has multiple kids. One of them was on the spectrum. Another one had another type of issue going on, et cetera. And so we started working with the daughter, right? And the mom was just observing. And she said, man, like I've already seen changes in my daughter. Do you think you can do anything for my anxiety? So we We checked her out. Sure enough, she had a Moreau, a retained Moreau reflex. She also had some other things going on, some neurological imbalances. And so we deployed some very simple strategies. We educated her. We treated her very briefly, not much. Okay, so we did some primitive reflex integration therapies. We did some laser and light therapy on her. We sent her home with those exercises, right? We're big on home care because for neuroplasticity to occur, we need frequency, intensity, and duration of stimulus, right? This isn't something where we do something a few times and then boom, the brain changes. Although sure, that can happen, but typically we need this type of repetitive stimulus. Home care is very, very important in our office. And so the mom goes home, she's doing her things. And she calls us about a week later and she goes, oh my gosh, my anxiety has dropped dramatically. In fact, I'm not having to take my anxiety medications anymore. This is huge. And so we're like, great, keep it up, continue doing your stuff. And then she calls back maybe a couple weeks later, I forget. And she's actually completely off of her medication. And it was and she wasn't exactly wanting to come off of the medication. That wasn't really her mindset. But what happened was her symptoms were improving so much that she was then experiencing signs of being over medicated, right? And so that's where she began to come off, and now she's completely off, right? So we can have huge impacts with mental disorders. And in fact, to kind of bridge the neurodevelopmental paradigm with mental disorders, if you look at the statistics, neurobehavioral disorders and mental disorder statistics are paralleled, right? And so basically what I'm saying is kids are having struggles. They're having these neurodevelopmental challenges, whether it's ADHD or whatever it may be, but they're not being treated, right? They're not actually getting to the underlying cause and developing these networks so these kids can thrive. And what that's turning into in adulthood are these mental disorders like anxiety and depression, et cetera. So there's a big correlation there. And that's what we tell everybody is that, someone comes in with, anxiety, just to continue talking about anxiety, right? And then we go through their history and well, guess what? They had ADHD as a kid, or maybe undiagnosed ADHD as a kid, right? And so we see that quite often, right? And then, so with the neurodevelopmental story, this one is something that this is definitely my wheelhouse. I love working with neurodevelopmental issues. It's where I started my career. It's my specialty is neurodevelopmental neurodevelopment in childhood. And so what we see is, again, we have this blueprint, right? We know the brain is supposed to develop from the bottom up, right? So from the brainstem up and then from the right to the left. And then we get this nice oscillation back and forth as the hemispheres begin to develop. And the interesting thing is, as you then develop into adulthood, yes, we have this hemispheric brain, but what we want is this brain to continue to grow and interconnect and develop this nice, robust connectome, right? So it's called the connectome, where we have all of these little hubs in the brain that are functionally connected and generating this, nice reality, and we're getting good perceptions and all of these things, right? So we start out very hemispheric in childhood, and then we want to grow into this adult with this more interconnected, more complex brain. That's how it should work, right? But if something is happening along the way, be it, again, a chemical stress, an emotional stress, there's so many things that we could go down the line and list. And then I have a whole nother discussion on the importance of light and how improper light exposure could perhaps alter neuronal migration, then affecting our epigenetics and setting us up for these changes that we're seeing in neurodevelopmental issues, right? And so again, it's the same process. That's the beauty about what we do, is that it's the same exam. It's the same line of thinking, right? We're going to look at that child and we're going to say, okay, let's check the sensory systems, let's check the primitive reflexes, et cetera, et cetera. And then that defines what we need to do. And then we find those neurological imbalances, and then boom, we're off to the races. So it's been a very rewarding career. I've had many children now that were actually diagnosed autistic that are no longer diagnosed. Like literally, I've had girls. I had a girl from the state of Georgia that she was amazing But she came in literally wanting to rip our faces off, right? I mean, she was intense, and we stuck with it. The mom stuck with it. She had, she believed in what we were doing. We were explaining things along the way, and then literally, there was a huge shift in her. She began to speak. She began to be emotional. She literally, now she'll come in, she'll hug you, she'll give you a high five. I mean, it's amazing, the types of transformation that we get to see in these children and in the adults. It's just so amazing.
Brilliant. Sounds like you're doing incredible work. All right, Dr. Brandon, sounds like you've been dealing with clients for a long time and patients for a long time, whether it's an adult with anxiety or a neurological issue that forms a psychological issue, and children across the board. Possibly take us through your auditing process. I mean, so many things can cause insult onto the nervous system. I mean, from mycotoxins to any type of aflatoxin. And then you've got obviously malillumination. I had Dr. Jack Cruz, what's it now, 3 years on the podcast. We did a double show. It's our most downloaded show, talking about light and talking about malillumination and how important that is. But take us through your auditing process. Is it functional medicine? Is it electromagnetic radiation you look at? Is it obviously the functional neurology you've spoken about, assessing the different systems? But take us through the overall arching process.
Yeah, so you're right. It's multifactorial. I think it has to be, right? So anytime anyone's engaged with a complex neurological condition, any of those things you mentioned, but then we're also heavy with brain injury. We actually saw massive growth with brain injury because we get very good results with that. But we always start with the energy, right? So we have pillars, right? So we call them the NeuroSolution pillars of health, and that's the ESM methodology. So energy, sensory, and movement. And so the first thing we want to check is cellular energy. I'm very heavily focused on the electron transport chain. I want to know, do we have a good NAD pH ratio? I want to know if electrons are flowing through that chain properly. At complex 4, are we producing good exclusion zone water? Are we getting proper light so that we do stimulate the fourth chromophore to produce that water, but then also to help the ATP synthase actually generate ATP, right? So that has to be a big part of our assessment. A lot of that can be gathered through history. What are your daily activities like? How much screen time do you get? How much outdoor time do you get? Energy levels can be a telltale sign, right? I was just talking with someone from, I forget where they were, somewhere in America, before getting on this podcast, and it was very obvious, right? They wake up and their energy levels are relatively okay, but then what's the first thing they do is they get on the iPad, they start doing these things that are not, that's not what we're supposed to do. It's not what we're designed to do. And then what happens? Their energy levels plummet, right? And then they can't get them up throughout the day. They don't have energy to go to school. So all of these things start to develop, right? That's a cellular energy problem. A lot of the CRPS patients that we see, so chronic regional pain syndrome, this is a big problem too. They don't have that cellular energy in order to heal, right? Obviously, there's central pain components and limbic system and all these things that we have to work through. But if you don't get that cellular energy right, if you don't get your light exposure right, then it's going to be hard to fully heal and optimize that person. So it has to start at that level. And then the other thing, and again, going back to the neurobehavioral challenges in brain injury too, is actually non-native EMFs. That is something that we do like to take a look at. For example, is your child sleeping next to an outlet, right? Is their head right next to an outlet on the wall, or, these types of things. And I'll literally just have people purchase a tri-field meter, off of Amazon or something like this, and just check their house. It's crazy what we find sometimes. You can get these non-native EMFs that are literally right beside your head all night, and that can cause a problem. And what I tell people is, what happens to a steak if you put it in the microwave, right? You cook that thing in the microwave, what's it going to do? It's going to come out dehydrated. It's not going to be that nice juicy steak that you got off the grill. Well, that's basically what happens to the cells, right? We start to lose that exclusion zone water in the cell. We start to reduce cellular energy capacity. And just side note, I mean, Jack Kruse is phenomenal, so I'm sure all of this has been discussed, but that exclusion zone water is important. If you look into Gilbert Ling's work, Joe Pollack's work, I mean, that is literally like a battery source for our cells, right? You have a positive and a negative end, and when it's compressed, it generates energy for the cell. I mean, that is huge. So if we start losing that, that is going to cause cellular issues. And then obviously reduction in ATP, et cetera. So that's a big problem for people. And I think that generates so many plateaus in healing for people because they don't know how to navigate these situations. Things like, getting enough infrared and far infrared and red light exposure, things like being outside as the sun's coming up and setting, little things like that can go a long way. Cold thermogenesis, again, Jack Kruse is huge on that. So am I. I try to jump in my cold plunge at least 3 to 5 times a week. But that's going to do anything from, generating UV light from within your cells to drive electrons through that electron transport chain so that we can regenerate tissue, et cetera. But then what we have to do is we have to understand how important sensory is, right? So we have to go through all of our sensory pathways. And so when I explain this stuff from a broad level, the energy, sensory, and movement, right? I compare it to a car, right? So if you have a Lamborghini and it's an amazing car, one of the fastest cars out there, but there's no gas in the tank, good luck, right? So that's equivalent to that energy pillar. But then we have our sensory systems. Okay, well, if our sensory systems are not proper, they're not intact, right? Like I just did an exam on someone yesterday. It was a brain injury patient. And guess what? They want to walk like everyone else. But he couldn't feel his right leg. And no one ever looked into that. And so I'm like, guys, like if we don't have proper sensory system integration, we have to have that in order to move properly. And so our sensory systems, number one, they're like our spark plugs, but number two, it's like our steering wheel, right? So it's going to start the engine, but then it's also going to steer us and help us navigate throughout life, right? So it's essential to have adequate sensory systems. And then we go into movement, right? And with movement, right, this is the pistons moving in the engine. It's huge. And there's a very structured way to look at movement, right? So we like to look at it from a perspective of concentric muscle tone leading into isometric muscle tone and then eccentric muscle tone, right? We have an order of progression and various exercises and things to navigate through that. But if we go through that order, we do that because the degree of mitochondria, the number of mitochondria needed in each of those muscle fiber types increases as you move up the chain. So our concentric tone, which are tied to the lower order brainstem primitive reflexes like the reflexes in our hands, feet, mouth, spine, and that Moreau, that's our concentric tone. So we use those reflexes to build concentric tone, increase mitochondria in the muscle spindles. That then will convert that muscle type into isometric, right? And so now we need more mitochondria because that's our postural muscles. Those are the muscles that need to fire longer for longer durations, et cetera. Well, those are more connected to the middle of the brainstem, and those are our tonic neck reflexes, things like asymmetric tonic neck, symmetric tonic neck, and tonic labyrinthine, right? And so now we can use isometric exercises coupled with these primitive reflexes to then build even more mitochondria in the muscles and then build our eccentric muscle tone, which are then connected to our postural reactions so that now we can navigate our world properly. If we get pushed, we have a propping, hopping reflex, a head riding reflex, et cetera. And you need that push-pull type of muscle tone, which is defined as eccentric, in order to do that. And then extremely important in this part of the neurology, now we start to develop our reticular activating system. And this is our filter. So this is our filter that helps us navigate our world physically and mentally, right? And there's a whole conversation to have about that. But so that's basically the outline, right? That's what we're looking at. We have to look at the energy of the cell. Are there issues there? Because if there are, we have to clear those. We have to get the cell up and running and optimized first and foremost. And then we have to build adequate sensory integration, because if we can't feel our body, we cannot navigate our environment, period. And then we have to build a structured approach so that we have proper and targeted goal-oriented movements.
Yeah, brilliant. What an outline addressing the different systems. Very comprehensive, Dr. Brandon. Well done to you. I do want to talk about light because it seems like you're a light expert, and I think that's fundamentally important. I've shared on the podcast before that, my family's from Cyprus, from a little Greek island, and when I go there and see my parents, and we're outside and often at the beach and the sea, and it is relaxed, and I get a lot of sun, my heart rate variability goes up 80%. It increases by 80%. And it's phenomenal just what happens to your autonomic nervous system getting the right light. Even here in a big city, I've got my red light here. I'm in the sauna, my infrared sauna, 5-6 days a week. I've never missed a day's work to sickness or ill health in 25 years, not a single day. But my numbers are not nearly as good as when I'm getting the correct light from the sun. God created light. So give us your perspective on malillumination, how important light is from a functional neurology perspective.
Absolutely. So I think you nailed it, right? The thing is that before, so I'm a faith-based guy, like you and many of my followers and patients know. So I'm a faith-based guy. And here's the thing, before God created life, he created light. And so light is necessary and it has to precede life. And so if we have this working order, right, if we know that from the very beginning, we were designed to actually need and be sustained by light, that should speak to us, right? That should tell us that this is important. We need to understand it. And now what we know is that not only do we need certain types of light, which we'll get into, but there's actually problems when we have overexposure to other types of light, right? So for example, the high frequency, 400 to 490 nanometer white and blue light, right? So screens, fluorescent lighting, our phones, all of these things, et cetera, right? So I don't want to say an overarching like this is all bad, but we're absolutely, especially in the modern world, very big problem in America. We're overexposed to it. And there was actually a study that came out that showed when our retinas are actually exposed to this type of light, it actually begins to degrade the retinal tissue. So we actually start to see physical damage in the retina. This is very important because the retina, it's an extension of the diencephalon. So it's an extension of the brain. It is neuronal tissue. So we can extrapolate from that study and say, look, not only is this damaging to the retina, but this is damaging to the rest of the brain. This is not good. This is why we do not need our younger generations constantly on the iPad, constantly on the TV, constantly on the phone, right? This is not okay for our generations, and it's taking us backwards because it is not how we're designed to grow and optimize and thrive. So that's number one, is we have to understand the malabsorption or the malillumination problem, right? And so one thing to understand, if you're a listener just really kind of getting into the basics, the nuts and bolts of this, just understand that our body, we have these things called chromophores all over us, inside of us, outside of us, and think of these chromophores as solar panels. And so just like you can have a solar panel on your house or whatever, that solar panel takes light energy and it transforms it into electrical energy. So these chromophores are doing that for our cells, right? We need that. Our cells actually are designed to use light as energy, right? We do not get all of our energy from food. That's actually not how we're designed. So we have to have this light. And we know that if we have improper exposure to sunlight, prolonged periods of darkness, we get things like seasonal affective disorder, depression, anxiety. It even leads into autonomic dysregulation like gut disorders, IBS, and this type of stuff. So it's very well stated in the literature that if we don't get proper exposure to light, it will manifest as something, mental disorder, autonomic dysregulation. You mentioned HRV improving. Absolutely. I mean, being on the beach and listening to the oceans, typically the ocean is coming in at a nice steady alpha or a theta wave, right? So that's in training your brain wave, you're getting good sun exposure, you're recharging your cells. I mean, lots of amazing things begin to happen whenever we just simply go back to the basic design of how we're supposed to grow and thrive. So that's what I want practitioners to understand. That's what I want my patients to understand, is that we have the tools needed, right? Yes, I develop lasers. Yes, I've got therapy lasers and all these things, and that's important. But at the same time, you don't need a fancy laser at home to begin to harness the power of light, because God made it. It's in the sky, right? We need to get outside. We need to use it. We need to get out from under the fluorescence, get off of screens, etc. Right? So it's hugely important, vastly important. There's even right now we're actually doing a study with Cornell University. And we're doing this in my practice. My colleague and business partner, Dr. Jerry Levine, is the principal investigator, and I'm carrying out here from a clinical perspective. But we're looking at how different wavelengths of light actually alter brainwave states, right? And so you can put different filters in front of the eye. We're doing it with Erlen, the Erlen Foundation. So different wavelengths of light affecting vision, right? Well, it goes beyond vision, because what we're seeing is that someone can come in with a lot of slow wave activity, or a lot of high beta waves, anxiety, this kind of stuff. And then literally, as soon as we put the proper wavelength of light in front of their eye, brain waves change. And it's been very eye-opening. We've seen it clinically. But it's been very amazing to watch this just from a very objective standpoint, and I'm very excited to continue that study and publish the results and everything. But we need to understand that we are extremely susceptible to light. And we're going to be susceptible no matter what. So you better optimize it, right? Don't turn your back to it. Don't sit in a dark room with the TV on and think, well, that doesn't apply to me. It applies to you. If you're breathing, it applies to you. So get outside, get out from in front of the screen, start doing things right, and your health will begin to change.
Brilliant. Wow. That's a great summary on light and how important it is from a neurological point of view. 2 quick rapid fire questions. How important is it for our children and even adults to wear, the blue blocking glasses from 400 to say 550 nanometers like this? I mean, their brains are developing. Obviously, get as much sunlight as you can in the day without burning. Get the morning sunlight to prepare the melanocytes in your body, to prepare yourself to, produce melanin so you don't burn. I think that's fundamentally important. But, how important it is for especially the new generation and the youngsters to wear these type of orange glasses at night?
Extremely. So I usually keep mine right here on my desk, and I took them home. I don't have them right now. But it's very important. So initially, first thing in the morning, like you said, we want to have that early morning sunlight. We want to have that higher frequency light come into our retinas, and that's going to help with the neurochemicals. It's going to help begin to wake us up, set the hormones for the day, etc. Right? So we want that. But then if we're going to have continued exposure to that higher frequency light, it is very, very important to actually protect our eyes from that. Like I said, it can cause retinal damage even. My own children, they have blue blockers and they have Erlen lenses. The Erlen lenses will actually block the blue light as well, right? So that's the cool thing with those, is that you get not only the wavelength of light that impacts, reduces the stress response and helps your brain function better, but it also begins to block the blue light, right? So if we're exposing our eyes to this type of light at night before bed, it's going to greatly alter our circadian biology, right? And circadian biology does not just have to do with sleep. This is a whole set of various types of genes that can have an impact on all types of neurophysiological aspects of life. It can cause a chronic stress response. Obviously, it can impact sleep. It can begin to impact inflammatory status. It can impact all different types of things. Our circadian biology is what runs our body. I mean, we are set, going back to this whole concept of sun up, sun down, our entire neurophysiology is actually based on the sun, right? So whenever the sun's coming up, we have a whole subset of neurochemical responses and et cetera. And then as the sun's coming down, the same thing is happening. So we want to be able to allow our neurochemistry to do what it's supposed to do as the sun's coming down. Because if we're watching a screen, we're not blocking that blue light from our eyes, then our brain is getting the wrong signals. Even though the sun's coming down, it's getting, I still have this high frequency light, so I'm going to continue to produce, norepinephrine and all of these things that are not going to be conducive to proper circadian biology.
Sure. Yeah, circadian rhythm, so important. We'll put those links into those podcasts with Dr. Jack Cruz and many others. Leland Stallman as well, doing a lot of work on light as well. Fantastic. So tell us about this amazing laser. I've been in practice for a long time, did my undergraduate in physical therapy. And obviously there's a lot of physical therapists and occupational therapists doing functional neurology. But what I do know is not many of them have devices. I think there's one or two that are doing, I think Dr. Stephen Porges's work here, but you're the light guy, the light expert. Tell us how you incorporate this amazing laser, how you developed it, and how you use it with your patients and clients.
Absolutely. So the necessity of the laser came out of how we began to really work with so many different complex neurological conditions. That doesn't mean that it's only needed for those complex conditions. That just means that one thing that I've always done is we always monitor neurological fatigue or metabolic fatigue, right? So we can stimulate a person so far, but we don't want to exceed thresholds. And so when we used to work with someone, it might be a 6-hour day. And 2 or 3 of those hours, we might have to back off, let the person rest, recharge, et cetera. But now with the incorporation of the laser, we can support cellular energy. Now we can actually enhance neuroplasticity, and we don't have near the amount of neurological fatigue. So that's basically where the need came from. And then what we have to understand is that there's many different types of lasers out there. And there's several different things that are important. Number one are the wavelengths. We know that there's certain wavelengths that are extremely beneficial, such as red, infrared. We do use far infrared for various applications. We use violet. Violet is very beneficial even for things like infections, skin conditions, et cetera. It has a higher energy photon. So there's various things that we can do with that. We're now exploring what we can do with the green wavelengths. Green is interesting because it penetrates through water way more effective. So we can essentially reach target tissue at a deeper level. Now, that's a little bit more of a discussion that we could have on that. We're still going through some research and some clinical things to better understand that. But there's wavelength, but then there's also frequencies, right? And so the way that the light pulses, that's referred to as the frequency or the pulsing rate. Frequencies are important. I talk about them like they're languages, right? So if you're speaking to me in Arabic and I reply to you in Spanish, we're both speaking a language, but we may not understand one another because we're not speaking the language that we understand. And that's how light and sound and all these different things can communicate to specific parts of our body, right? So different frequencies communicate differently to different parts of our body. And we even see that in the research where, 10 hertz can stimulate the vagus nerve better than a continuous wave laser. That was a research study done, et cetera. And so what we've done is we've actually gone through the research, but then we also have our clinical experience to know, what parts of the body respond better to different frequencies of light. And then, of course, there's brain waves. We can induce brain waves by pulsing certain frequencies of light into the brain. We have research out there now that tells us 40 hertz on the brain is very beneficial. It can improve cognition. It can actually decrease plaquing in the brain, et cetera. So we know that frequency has a huge impact on the brain. And whenever I first started this, I was very frustrated because the lasers on the market, like they didn't pulse. They didn't have this frequency capability, or if they did, it was very limited. And so that's a huge differentiator behind what we have, and even what we're developing. But then there's another component, and that other component is actually the beam physics. So literally the shape of the beam, we can do things like diverge it. We can cancel certain parts of the beam. We can alter the shape of the beam. And again, that goes to allow us to better target it, right? So for example, for one procedure, we use a certain laser that was actually developed for this procedure where we actually laser PRP. Like, so you're very familiar with platelet-rich plasma. And so this laser was actually designed to enhance the growth factors, and enhance the surface receptors on things like the very small human embryonic-like stem cells that can be within the PRP solution, right? So we get this enhancing effect of the PRP, and then we can actually use that laser, again, with this patented beam cancellation technology on the tissue that we want those cells to influence the most, because what it's going to do then on the body is alter surface receptor proteins. So as that solution is going through, all those cells are they're essentially getting sticky, right? And they stick in that tissue better. So it helps us better target, whether it's the brain, the body, whatever it is. And so there's various things to consider there. Now, within that, we also have to understand something called the biphasic dose response curve. And this is a big topic that I've spent the majority of my career on. So let me kind of walk you down this path in my lineage of thinking here. And this is where the majority of my IP is in the work that I've developed thus far. But basically, I started, like the majority of everyone, with the very low-powered lasers. And that's what most people do. That's where most of the data points are, because that's where the research started. But we have to understand the biphasic dose response. It's basically saying that too little of a stimulus doesn't do anything, and then we have this just the right amount, and then too much is going to cause harm. Essentially, that's the biphasic dose response curve. And this applies to everything. This applies to drugs, to nutrients, to exercise, to everything. And when you look at the literature, what I noticed is when I would use the parameters within the literature, patients might get better. They might get a little bit better. And I was like, man, what's going on here? And then I started thinking, I was like, you know what? When I'm sick, I need more water. I need more nutrients. I need more rest. So what happened? My biphasic dose response curve changed because of my state. And so that really started me thinking, I'm like, okay, I'm dealing with some pretty sick people, with people that have issues, functional imbalances, et cetera. So I wonder if that alters their hormetic curve, which is the same thing as biphasic dose response curve. And so very carefully, we started to increase the dose, et cetera, monitoring for things like metabolic fatigue, neurofatigue. And all of a sudden, we started getting these better results. And I thought, okay, I'm onto something. Well, what if we can actually target the tissues even better? Is there a strategy for this in the rehab world? And so I looked and I found information that said, look, if you increase the metabolic rate of the tissue you're trying to target, that actually means that that tissue will have a more dramatic response to the laser light therapy. And so I said, great, I know how to activate systems in the brain, in the body, et cetera. So if I want to activate like a certain part of the cerebellum, I can do muscle contractions, vibration, like I can target specifically the area of that cerebellum that I want to have an influence on, and then use a laser while I'm doing the stimulus or immediately after. And that's what we call co-activation. And within co-activation, we also alter the biphasic dose response curve because we're increasing the metabolic demand on the cell. So it needs more energy. Just like if you're driving your Lamborghini down the road and you floor it, you're going to use more gas. Same thing, right? So these are the things that the literature is not reflecting. And I'm not saying anything bad about the literature. I'm just saying that we need to think through this with the lens of a clinical perspective, like what is going on in that person in front of you. And we need to be able to apply this information clinically so that we can really get people better. And that's what we've done. And I have confirmed my theories. We've done pilot studies. Obviously, we have thousands of patients from all over the world. And I can assure you, if they were not getting better, I would not have a thriving practice and opening more. But that's the thing that we need to understand, is that number one, this divergent quality and the beam physics specific to the products that we're using are very, very important. That makes the laser very safe, and it makes it more effective. Okay, so that's number one, right? I'm not doing this with lasers that are super, collimated and et cetera, right? Because that increases the dose too fast, right? So I want to be able to saturate an area. I want to be able to have this longer duration but higher dose quality to my laser. I want to be able to pulse towards the tissue that I'm trying to target. So for the cerebellum, I want to pulse that light at 8 to 12 hertz because that's what the cerebellum responds to best, is per our clinical experience. And we got the information on the inferior olive, which oscillates at 8 to 12 hertz, which generates our physiologic tremor in our muscles, right? And so we've gone through that process and outlined this very, very meticulously. And like I said, the end result is we're getting better clinical results. We're continuing to push the mold, which I think is extremely important in healthcare, right? And I love where we're at. We're getting great results, but we have to get better, right? We got to do better. We always have to innovate. We always have to push. And that's what we're doing. We're developing a whole new line of technology right now. There's a lot of things coming down the pipeline that we're super excited about. So I don't know if I went too far off tangent, on the tangent there, but I can go in so many directions on this topic.
No, I think it's brilliant, because I think this is what's needed out there. That's not being said by many practitioners that are doing your work, and trying to do neurodevelopmental work and using vibration therapy and electrical concurrence, which I'm sure you do, but there's a gap in light therapy. And so there's a gap in laser therapy. And that's why I wanted you to really explain that. So do you put the laser over the certain parts of the head or the back of the neck, or in certain points of the body? Where does the laser go while you're doing the movement?
Perfect question. Okay. So one of my favorite things to do is actually something called blood illumination. And so this was actually first studied in Russian literature. And what they started to do was they would illuminate an artery to influence the tissue distal to that artery, right? And so I saw that and I saw, okay, they're getting good results there. Well, what are some arteries that I can use to influence the brain? And so we have this carotid artery right there that everyone knows about. You can feel the pulse. So we'll actually laser over that carotid artery. And what that does is that increases oxygen, blood flow, growth factors, all these things, right? We get this more widespread effect in the brain. That's typically how we will start someone, right? We'll use the carotid artery. We'll also use the vertebral artery, which is just behind the ear there. Is where we'll access it. That one's really important because that one goes right up into the brainstem. Now, if I'm, like you heard me say earlier, if we're working on a lot of primitive reflexes, et cetera, then what we're going to do is, start there, and that's going to increase blood flow into the brainstem. Very, very important. So those are two very key access points to start someone off with. I'll even do it, before, doing a podcast or lecturing or starting with patients. Again, just a good general thing to do for brain health, et cetera. And then as we're progressing through rehab, what we're going to do, again, through the exam, we know what we're trying to target. So we may be targeting the brainstem. Again, we'll go behind the ear. We may be targeting the cerebellum, which is similar location, maybe just a little bit more midline. And then we start working through the brain. So we can be very specific, even right down to like a Brodmann area. That is something that we can do. Or we'll stay within the major hubs of the brain. And so in the brain, we have, I typically talk about three major hubs. We have the PTO, or the parietal temporal occipital hub. This is like the brain's major airport, right? This is where the majority of the senses are coming in and converging. So if we reference the ear, we go up and back, right? So this is the parietal temporal occipital area. That area then has an influence on our motor systems. And so we have this motor strip just in front of the ear, and it's going to come up all the way up to the top of the head. So we have this motor strip that we then focus on heavily. And then we have this prefrontal cortex, which is over the forehead. And that's kind of a broad level view of how we'll take things. Again, sensory, motor, and then we get cognition, right? So sensory drives motor and motor drives cognition. And so that's how we'll typically work through care. But then we have all types of other different access points. We'll go through the temple to access the top of the basal ganglia, the midbrain area. We can go through the nose. We actually have attachment pieces to go intranasal. We can go through the mouth, angled upwards to start to get the front of the brainstem, the lower part of the brainstem, etc. So all types of different access points, but those are just a few examples. And then going back to the blood illumination component, we also like to use the laser over the abdominal aorta, which is just above the belly button, because then we're improving blood flow into the organs, down the legs, etc. I've even on my own self, I'll laser over my heart. Obviously, that's a big area of blood supply, just to have a big overall systemic influence. So just some of our favorite techniques to use.
Brilliant. And talk to me how important the cervical spine is. You know, my mentors in Fort Myers, Dr. Ross Hauser, we'll put a link to the episode on cervicovagopathy structure, urochiropractor, O1, C1, C1, C2, and C3. He measures blood flow to the brain, getting the neck in the position that it should be, the instability in that area, and just not having the correct alignments, cervical disc structure. It's quite a fascinating area, and obviously looking at all the devices that the kid's on, and in this position over here, changing the cervical spine and changing the impact on the vagus nerve and vagal tone. How important and how much work do you do in the cervical spine?
A lot. Yeah, the cervical spine is so important. It has a huge influence on our vestibular system, so our inner ear, helping to align the eyes. It has a huge impact on that. In fact, you can have syndromes where the cervical spine, is dysfunctional, and it can actually mimic concussion symptoms. So it's highly important. It's something that I think is overlooked way too often. I'll have someone come in with a traumatic brain injury, and they're having vertiginous symptoms. The room is spinning and all of these things, of course. And we're going to go through the checklist, all the different things. But there are times when it's not only, a vestibular imbalance, but that neck, right, because of the dysfunction, the trauma or whatever, that is actually generating the abnormal sensory input coming in and causing a lot of that symptomatology. It is something that is overlooked repeatedly in our, not my field of functional neurology, but in traditional medicine. And so it's extremely important. And you mentioned the vagus nerve. Absolutely, man. We have some great access points to that vagus through the neck. There's all types of ways we can actually stem the vagus nerve. We have a certain types of pulsed radio frequency device, and it's amazing just to watch the heart rate changes, the autonomic changes as we're doing it. We're very meticulous when we do it. It's a very detailed procedure that we do, and the influence is huge. But yeah, cervical spine is quite interesting. I'm consulting on a case right now of someone with cranial instability, right? So they've had damage to the ligaments up where the skull attaches to the spine, quite substantial damage. And what it's done is it's allowed for whenever that person is just breathing, right? Whenever you have the exhale and the inhale, you should have this certain CSF flow, right? Well, because of this, it's caused instability, so that now that CSF with their respiration is actually getting stuck, right? It's not flowing like it should, and that's putting pressure on the brainstem, and that's causing a whole host of issues in the body, in the head, vertigo symptoms, autonomic dysfunction, etc. Right? So it can have a huge influence on someone. And look, if you're just trying to stay healthy and well, it's very important, in my opinion, to have your neck checked out by a good chiropractor, to have good muscle tone balance within your neck. You said it, having that chronically flexed state of the neck is not good. That chronic flexion that's going to start to overactivate your sympathetic nervous system, your fight or flight, right? We need good extension tone. Very, very important, right? What I tell people is, look, if you're trying to run away from a bear, right, you're going to be in this flex position. You're not going to be in this nice extension pose, right? But if we're trying to live life optimally, be able to have a good perception of reality, be able to, scan things and make decisions, good quality decisions, we don't need to be in this sympathetic state, this fight or flight state that's going to alter our reality. So proper flexion extension tone is highly important. So yes, like you mentioned, extremely important. Maintain proper muscle balance, maintain joint integrity. That's where the, things like chiropractic and things like that come to play. Highly, highly important.
Brilliant. Last question, Dr. Brandon, thank you so much for your time, is many people battle to sustain their transformation. They change their life, their nutrition, their exercise, look at the emotional health, especially when they've incurred in disease or sickness, but they lose their way in terms of their healthy habits. It doesn't become a lifestyle. I know internal drivers and external drivers are so important from a motivating perspective. How do you keep people sustaining their transformation?
Yeah, that's a very, very good question. The first thing is education. They need to understand what goal setting and what the mindset of setting goals does for them. It's not just about, wishful thinking and writing things down, all this kind of stuff, but the act of setting a goal. It's actually specific to neurology. So it involves certain neurotransmitters like norepinephrine, dopamine, acetylcholine. This is very important. And so the first thing is we need that norepinephrine. We need that drive. We need something that gets us up and gets us going, right? But then we also need that focused attention. We need something that we can focus on. That's why if you don't have something you're looking forward to or something you're striving towards, right, you're just a drifting ship, right? That's not good. So that's acetylcholine, is that nice targeted focus. But then what's ultimately going to get us there is that dopamine. And so we need little wins along the way, right? We need to define what we want on a daily basis, a weekly basis, a monthly basis, a yearly basis, etc. And we need to acknowledge the little wins, right? Because those little wins are going to generate more dopamine along the way so that we continue to pursue, right? Dopamine is that pursuit, right? It can override the norepinephrine. If we get too much buildup in the synapse without the dopamine, we shut down, we stop. So we need those little wins to continue to push forward all the time, right? And then, we've talked about several things that can alter our dopamine levels. Things like improper light exposure, all this, blue light toxicity, all of these things start to alter our dopamine systems and can really impact our mindset, right? So that's what I tell people is like, look, you came in, this is your goal is to live life like this, and you're getting there, right? You're getting there. But look at this little change. This is important, right? Acknowledge it, be thankful for it, be grateful, and continue towards the next little goal, right? That's what I tell people.
Brilliant. Thank you for your time. I want to just declare favor and blessing on you, and that you would just continue this courageous calling of transforming so many people's lives. And I want to blow wind in your sails, and we'll share this far as wide as much as we can. And then also how people can just connect with you if they need laser therapy, they need an assessment. I know you expanding, but for people in Africa, how can they connect with you?
Absolutely. So I think if the best thing to be able to see our work and to see our stories and the transformations, we try to put that on my Instagram page. So my Instagram handle is at B Crawford DC. So B as in boy, my last name Crawford, D as in dog, C as in cat. That's my Instagram handle. My office website is NeuroSolutionATX.com. And yeah, those are probably the best ways to begin to interact with us. But yeah, man, thank you so much for the opportunity. Thank you for what you're doing in changing the world. Very appreciative and excited to be along this journey with you.